Hello everyone, my name is Yasla Miranda, and today I will be presenting about bacterial meningitis. So my statement of work, it took me about 12 hours to complete the project. Um, so what is bacterial meningitis? Bacterial meningitis occurs when there is inflammation of the tissues that surrounds the spinal cord towards the brain. It can be life-threatening and it could affect people of all ages, transmitted from person to person, and can be caused by different species of bacteria, viruses, fungi, and parasites. So the signs and symptoms of bacterial meningitis can differentiate between older children and adults, and babies and young children. So in older children and adults, um, fever, headache, nausea, and vomiting, photophobia, confusion can occur, and also drowsiness and irritability, also seizures and strokes. Whereas in babies and young children, they might have trouble waking up, they're very sleepy, they have low energy or they're lethargic, there's irritability, there's seizures, and a bulging of the fontanelle, which is the soft spot on the baby's head and it causes it to be inflamed. Fever can also cause vomiting and they might refuse to eat as well. So the pathogen and taxonomy of bacterial meningitis. So there's 50 different types of bacteria that can cause bacterial meningitis, but different strains can affect different age groups. I took this picture from the World Health Organization. As you can see, there's a different type of strains affecting different age groups. So there's group B Streptococcus, E. coli, S. pneumoniae, H. influenzae, and meningitis, and also L. monocytogenes. But I will be focusing on Neisseria meningitis, and the taxonomy of and meningitis is that it comes from the families come from is Neisseria and the genus is Neisseria, and the species is meningitis. Neisseria meningitis is gram-negative, non-spore forming, non-motile, encapsulated, and appears in kidney bean shape under a microscope. It requires an aerobic environment with 5% of CO2. So geography, discoveries, reservoirs, and risk factors. Neisseria meningitis can be found worldwide, but it is abundant in the meningitis belt of sub-Saharan Africa, which you see in this image. The disease is to be hyperendemic and periodic endemics in the dry season, which is between December and June. Cases up to 1,000 cases per 100,000 in population. By contrast, rates of disease in Australia, Europe, South America, and the United States range from 0.10 to 2.4 cases per 100,000 population per year. Outside the meningitis belt, infants, adolescents, and adults over 80 have the highest rates of disease. Inside the belt, high rates of disease are seen in people under 30 years old and in children and adolescents aged between 5 to 14 years old. In continuation with that slide, according to the Lancet Global Health, previous epidemiological reports from individual countries outside the meningitis belt show various seasonal patterns of bacterial meningitis. So, bacterial meningitis occurs in Brazil between May to October, December towards March in the United States, France, and the UK, and July to September in New Zealand. So therefore, traveling poses health risks, so ensure your vaccines are up to date before going abroad. As you can see in purple, the purple dots is bacterial meningitis, which is between the months of February to April, and it's occurring like in Africa, countries in Africa, and that Neisseria meningitis is the one in red, which is around January to March, which is in countries such as in Europe, which is like England, Belgium, France, Italy, Germany, and then also the USA. Going along. So, the diagnosis of bacterial meningitis, healthcare providers will perform a range of diagnostic tests to determine the underlying cause of an infection, allowing them to accurately identify the causative organism and implement the most effective treatment measures. So by collecting blood and urine, mucus, also performing a cerebrospinal fluid CSF analysis, which also includes white blood cell count, glucose, protein, culture, and in some cases the PCR. And so the cerebrospinal fluid is obtained by a lumbar puncture or an LP. In order to treat bacterial meningitis, there's various antibiotics that are sent through an IV depending on the age and if there are any pharmaceutical allergies present, but also managing the airway, maintaining oxygenation, giving sufficient IV fluids while providing fever control are parts of the foundation of meningitis management. The type of antibiotic is based on the presumed organism causing the infection. In order to prevent bacterial meningitis, vaccines play a huge part to prevent meningitis caused by meningococcal, pneumococcus, and Haemophilus influenzae type B or Hib. And also washing your hands frequently, especially before eating and avoiding close contact and not sharing cups, utensils, or toothbrushes. Antibiotics for prevention is also um, there for those who are in close contact with those that have meningitis. And this is what the lumbar puncture looks like. So the social, economic, and cultural impact of bacterial meningitis. The ongoing psychosocial impacts of disability from meningitis can have medical, educational, social, and human rights-based implications. Despite the high burden of meningitis sequelae on people with meningitis, their families and the community access to both services and support for these conditions is often insufficient, especially in low and middle income countries. So the port of entry of bacterial meningitis. Most bacteria that cause meningitis, like Meningococcus, Pneumococcus, and Haemophilus influenzae, are found in the nose and throat and spread through respiratory droplets. Group B streptococcus, often in the gut or vagina, can be passed from mother to child during birth. The portal of exit of bacterial meningitis, when an infected person coughs or sneezes, the mucus around the virus evaporates, leaving a droplet nucleus. The evaporation rate depends on room temperature and humidity. Lower humidity speeds up evaporation, allowing droplet nuclei to remain airborne. In winter, low indoor humidity helps droplet nuclei survive longer as they are small enough to stay airborne indefinitely. The virulence of bacterial meningitis. Bacteria use various virulence factors to cross barriers and reach the central nervous system. These factors help them attach to host cells, invade, survive inside cells, trigger immune responses, and impact barrier function. To add on to that, these images kind of explain a little bit more. So in figure 1, bacterial pathogens enter the central nervous system through the blood-brain barrier or blood-cerebrospinal barrier, um, paracellular, transcellular, or the Trojan horse, pathways inside infected macrophages. These entry methods involve receptor binding or cell invasion, activating signaling pathways and actin rearrangements. Once inside cells, bacteria survive and trigger host inflammation, disrupting tight junctions and advancing disease. In figure 2, multiple virulence factors drive bacterial meningitis pathogenesis. Capsules help bacteria survive in the bloodstream, while downregulation occurs during cell adhesion and invasion, mediated by adhesins, pili, and pore-forming toxins. These toxins also assist in vacuole escape and intracellular survival. Additionally, interleukins and pore-forming toxins trigger host cell signaling and inflammation. All right, to summarize my presentation, I just want to say to take care of yourself, stay up to date with your vaccines, and drink your probiotics. Our health should always be our number one priority because a strong immune system is our best defense against diseases and infections. When we neglect our health, these illnesses can catch us off guard and drag us down, making it harder to recover. Prioritizing our well-being not only keeps us feeling good day to day, but also equips us to fight off harmful pathogens and maintain a high quality of life. Therefore, take the steps now to stay healthy. All right, and these are my references. Thank you guys for watching.